Okay, now I'm showing the how to harvest fasciolata here and making graft also. This is a cadaver and still frozen, but so I believe this is the greatest velocity, I guess. Yeah, so maybe this is the greatest velocity, and femur, yeah, like this. And I usually and in terms of septum around here usually, yeah. So maybe the I cut the skin incision like this. Maybe depend on the size of the graft, but usually 5.5 centimeter or 6 centimeter. Maybe in Japan 5.5 centimeter. So double is 11 centimeter. But after I cut the fasciolata, it shrinks, so decrease the size. So we need to harvest a little bigger. So maybe the 12, so 5.5 by times by 2, it means the 11 centimeter, but I need to make a maybe 11, 12 centimeter. And depends on size of the defect. So I now I'm making 3 centimeter and 3 and 5.5. So the 3 centimeter and 12 centimeter. So this this specimen is not so there are fatty tissue, not so many have fatty tissue. So maybe around 12 centimeter or a little more we can cut. And so now I do the skin incision here. The yeah, like this, and we need to expose the fasciolata. Yeah, we need to remove the fatty tissue. Actually, cut the fatty tissue, and yeah, this is a cadaver, so it's hard too. But this is fasciolata, I guess. Yeah, so this fasciolata. But today I want to cut skin a little more because I want to show very well. So the I cut usually the this much skin incision, but today I guess I make a bit bigger skin incision today. Yeah, it's not frozen. Actually, the export very easy. Yeah, but now I may cut the fasciolata. So I try to keep intact. Yeah, and yeah, this here. Yeah, now I can show very well. And this is fasciolata. Anterior side actually very thin. Yeah, so the here. So maybe the anterior edge of the fascia, maybe here. So the and in terms of septum, usually around here, we can feel usually, but this frozen, so I don't know, but it should be here, and and usually this part the thickest part, yeah, thick, very thick part. So usually I harvest around here, and this part thin, but double layer, so we need to harvest here. And let's see the 12 centimeter. Maybe I should cut, and I can expose more. Yeah, I in the patient I don't cut this much, but today I show you very well. Okay, maybe you can see very well, and maybe 12 centimeter. I cut a little more. And the marker, the marker pen, yeah, thank you. So maybe they're 3 centimeter, but if you cut 3 centimeter, maybe 2.5 centimeter after cutting. So maybe 3.5 or 4 centimeter we need to cut, and this much.
And go just below there.
Yeah, just below. Yeah, yeah. Here more proximal muscles. Yeah, so maybe yeah below the great velocity. Sometimes around here, but maybe here. And the 12 centimeter I mark. Yeah, can you like this? Yeah, 12 centimeter and 4 centimeter. Yeah, how to use the marker. That's why the Paul use some some paper, but it's the 4 centimeter. Yeah, it's hard to mark, but anyway, here it's around 12 centimeter. So I started to cut. First, I cut the anterior side and proximal. Yeah, and it like this. Then usually anterior side. Yeah, and yeah, still flows, but still flows. I don't want to destroy. Yes, so maybe that's okay. So maybe I check the length again. 4 centimeter here. Almost 4 centimeter, yes. Oh, yes. Thank you. But it should be okay. Yes, here's frozen. So I take out some tissue. Usually, there, in terms of septum should be here. I peel off actually. Today, frozen. So, and sometimes bleeding here during the surgery, like this vessel. So we need to coagulate always. And okay, can you see this here? So I check the length again, maybe 12 centimeter here. Should be a little more. Yeah, can you open here? Thank you. And there's yeah, this direction. Yes. That's this is the in terms of septum, but still frozen. I wait a minute. I warm up. Yeah, this tissue in terms of septum. Yeah, and this is a bus lateralis. Vastus is frozen, so but usually the bus lateralis pull, then we can see here. So that should be here. Yeah, that is bus lateralis, and this tissue in terms of septum. So we usually harvest this tissue. So the from the greater trochanter, maybe around 3 centimeter below, and in the distal, And then, okay, so now we remove the little more tissue and check the size again. And yeah, please. Yes. So check the size. Maybe 4 centimeter enough. Maybe 3.5 is okay. So marker. Yeah, maybe I cannot line, but maybe this line. Yeah, so maybe we can cut this here.
Yeah.
Yes, frozen, sorry. Then, yeah, can you put here? Yeah, thank you.
Swap that.
Okay, maybe frozen. Oh, frozen, so yeah, it's torn. So, yeah, maybe, yeah, you don't have to. Yeah, and, yes. So this is in terms of septum. So the from the femur, I cut this tissue. Yeah, it's it's not easy.
You could. You could. You could. Yeah. Upstream. You could have done it. So they're just going right down to the
Yeah,
there.
so sorry. Yeah, femur down. Yeah, this is a femur, but actually frozen. It's hard to feel, but this is the femur, and this is the graft, and this part is the internal septum.
Yep.
Yeah, so using this, maybe I can make a graft. So the and also after harvesting fasciata, we need to close here. It's this tissue to maybe vastus lateralis.
Okay.
Yeah, close this part is important to prevent hematoma. Yeah, so this fascia maybe the suturing to the vastus lateralis here.
Have to go too far with it.
No, maybe yeah, if you take out the intermuscular septum, then maybe you don't go posterior side. Maybe if you go more posterior side, maybe it's a nerve there. Yeah, sciatic nerve there. Yeah, but
Have you ever seen that complication?
no, actually not at all. Yeah, so maybe here is okay, but yeah, more deeper, maybe 1 or 2 centimeter deeper than here. So I never seen the nerve so far. Okay, so take out. Yeah, please take out this one.
Let's make sure it's.
And maybe I can show the how to make a graft.